Welcome back to Rohrichknose podcast, helping you become a better you. Hey, I want to thank all my subscribers and viewers. It's been an amazing year so far. I'm almost at 11,000 subscribers, lots and lots and more views. I just want to thank you so much. It tells me that we're probably doing some things right. I'm getting a lot of great feedback, great comments on both my YouTube, but also my podcast and my social media. So thanks so much. So let me know what you want me to talk about, and we'll make it happen. Okay? So let's dive in. Facelift trends 2025. What works and what wrecks? And there's a lot of things out there today to talk about in the facelift area because it is the hottest topic because of the deep plane facelift. But let's talk about what really works and what really doesn't work. So what really gives you a natural, beautiful face like this young woman that had a facial transformation with a deep layer facelift, selective fat? And is it the deep plane? Is that becoming the gold standard? The repositioning of deeper tissues, not just skin, and gives you more natural results? That's not necessarily completely true. But the deeper plane and deeper layer facelift is certainly not new. This is a variation of that. And let's take a deep dive into the anatomy. The anatomy is that there are some ligaments in the mid-face. This is the fixed part of the face. This is the mobile part. And this is the part that goes into the deep plane. There's multiple little ligaments here, zygomatic, mandibular, parotid cutaneous, and then the mesenteric. And if you release those, you can get a better, a more long-lasting lift. And that's the theory. And really, we've been doing that a long time with different techniques and technology. And, I've done all these different types of facelifts, but the deep layer facelift really mobilizes these deep layers. The deep plane does that and a little more, and it tends to do that. Does it give you a better and more long-lasting result? Time will tell. The literature would not necessarily support that, but short-term, it certainly looks like it's in the right track because in the deep layer, it's not where you start, it's where you finish. And that's really the most important thing. So that layer dissection, more medial, may make a big difference, short and long term. But don't forget that you can only lift so much of the face. You have to fill the central part because the parts of the face that age a lot are really ones that you lose fat on, and you can't pull up where fat isn't anymore. So what you have to do is you have to centrally, selectively fill the face, and we described that a long time ago on what makes it so important. So is it the deep layer or is it the deep fat grafting? Which one is more important? Well, I think both truly matter, and I think that's the key element here, is that both truly matter. It's that selective filling of fat in the deep and superficial layers, as you can see here, that really, really, really rings true. And then the deep layer lifting, like you can see in this beautiful lady. So both matter, the filling of the central part and the lifting in that area. Now, that's what happens when you do the central and outer face. But the finishing touch really is the laser or the skin texturing. And the laser resurfacing gives you that skin glow that complements that lift with the youthful skin tone. So it's filling and lifting the deep layer and then giving you a laser surfacing. And I love to use the Ultra Clear, which is a single core fiber laser, erbium laser that really helps to refine the nasal, the cheek area, the perioral area, like you can see here in this beautiful young lady that had a facial rejuvenation. All those things are central to lifting and filling the deep layer, but also to selectively restore the face. And here's a representative patient that actually just had laser coring. That's from the ultra clear literature, and really it's quite dramatic. And basically, when you put them all together, you can see a beautiful woman like this who's 11 years after a deep layer facelift, central facial fat augmentation and resurfacing, just gives you a natural yet youthful long-term look. And really, that really helps provide that harmony. So it's the deep layer, it's fat, and it's the skin resurfacing And then the final touch for harmony is the lip lift. And as we age, just like anything else, our lip sags, and you really, truly can restore the central face by restoring lip aging correction. And that's so powerful. So you can have a central lip lift. Here's a lady that's had that. Just in doing a lip lift, you can see it just gives her a more rejuvenative look. And really adding the power of a lip lift really is transformative in these patients. So putting all that together, when you do the deep flare lift, the central facial fat augmentation with laser resurfacing, you truly can get an amazing transformation. And again, you can see this in this patient that has an extended lip lift. So, and then the final touch to really give you the natural result is hiding the incisions, making so that you can't see the incisions. You know, you'll look at Angelina Jolie, you'll look at Brad Pitt. Can you see a scar? Can you look at a scar? And then you can see, you know, really distorted faces like, I hate to say it, like our past President Biden, who has a pixie ear and really has a lot of scarring in his area. You really want to try and hide the incision and get a natural-looking result. The scar invisibility goes along with an invisible natural result, as you can see in these patients. And you can see this beautiful lady who's 15 months post-op. You can't even see her scar because her ear lobule is beautiful. It's not distorted. Her shape and contour of her tragus is beautiful. And all of that looks natural, and that's what you want. So that's what to do, but here's what not to do. Don't do thread lifts. Don't overfill the face, either with fillers or fat. So you need to go to a facial plastic surgeon or a board-certified plastic surgeon that understands the science of aging and can accurately place the fat where you've lost it in the facial fat compartments. And then don't over-tighten. Don't give them that overdone, windswept look. And by and large, do not ignore the neck, because the key to a good facelift is a great jawline and a great neck. And you must make sure that that's a complete result. And above all, don't chase trends. Chase results that last. That's the most important thing. So know before you go, because as I often mention in these podcasts, you know, our goal is to be in the face protection, not witness protection program in plastic surgery, because you want to make sure that the patient looks as good as they feel and not distorted. And that's the sign of truly fantastic facial rejuvenation. Remember, you must look refreshed, not redone. Refreshed, not redone. And that is so, so critical. So give me your thoughts, give me your comments about what you think are the hottest things in facial rejuvenation. Those are the ones I've shared with you, and I'm happy to discuss them in your comments, both on social media and in my YouTube channel. So until next time, stay safe, stay informed, and be the best you can be.